Heart Health Clinic incorporates 3 different clinics. It includes the Heart Function Clinic, in which we take care of patients that have been diagnosed with heart failure or a cardiomyopathy or weak heart. It also includes the Lipid Clinic, in which we take care of patients that have complex cholesterol issues. And then finally, it also includes cardiac rehabilitation, which is a large program. Here we teach patients that have had cardiovascular risks or cardiac diagnoses to reduce their risk and incorporate exercise into their daily routine. The heart function team includes physicians, nurses, pharmacists, and nurse practitioners. So there's a rotating group of about 7 or 8 physicians that work in the heart function clinic. It also includes 3 registered nurses. There's also a host nurse, which is a hospital outreach nurse, 3 nurse practitioners that see patients independently and in consultation with the cardiologist. And it also includes 3 pharmacists. We have a social worker who helps us tremendously with patients that have social issues, and also have dietitian support that guide the patients with issues that may be causing their heart failure to worsen. We see over 17,000 patients in a year. We have a large portion of heart failure patients that are followed in the heart function clinic as well, and we're able to discharge these patients when they're stabilized. We've created a streamlined process where we're able to take high-risk patients that are seen in the heart function clinic that have heart failure and guide them to cardiac rehabilitation so we can get them back to their normal physical activity as quickly as possible. So we do have that streamlined process that may not exist in other clinics. There's been a lot of research in cardiology over the last 10 years, and so now we have a lot more medications that are being offered. Diagnostics have improved tremendously in cardiology as well. So what we're noticing is that there's about 50,000 new heart failure patients that are diagnosed in Canada, and incidence of heart failure is over 10% once the patients reach the age of 70. So we're picking up a lot more patients that have these diagnoses, and we're able to get them on the appropriate therapies by using new investigations, and we try to get them on these medications at the right time so we reduce their risk of worsening heart failure or dying from heart failure. What's new that we've started doing in the Division of Cardiology is that we've undertaken a new pilot project with the injectable loop recorders. In this project, what we're doing is we're inserting a small device that goes under the patient's skin right over their heart, and it monitors their heart rhythm for up to 3 years. We're doing this in a select population that's been pre-selected by the neurologists. And these are patients that have had a stroke where we're concerned that it's coming quite likely from an abnormal heart rhythm. And by identifying these patients that we haven't picked up an abnormality so far, we're trying to figure out if they've got an abnormality that can be treated to reduce their risk of stroke in the future. And pilot projects like these are very important for us to move care forward in the Fraser Health region. And so we're very thankful to the donors